Hi everyone. Wearing the mask may be the new fashion, fad or necessity, but as per the government directive, each one of us has to wear a mask, especially if we are in public places. So today's video is about maintaining mask hygiene. Who should wear the mask? Each and every one of us if we are exposed to anyone apart from our family members. If we are heading outside or heading to any public place, it is advisable for us to wear a mask. Why should we wear a mask? Many educated people also ask me this question. The simple answer is that we have to prevent any kind of secretions released from the mouth or the nose during talking, laughing, coughing from an infected person to an uninfected person. Now, the prevention of infection is the best if both the infected person and the uninfected person both are wearing the mask, and in scenarios where we don't know who is infected, it is best that everyone wears the mask, and that is what the government directive says at present. So which kind of masks should one wear? It could be the N95 mask, the regular surgical mask, the N90 masks or the fashionable cloth mask. It could be any of these, or simple mask that you or your mother have made at home. So it is important that you wear some kind of mask before heading out, so as to offer yourself at least some amount of protection as far as acquiring the infection is concerned. But there are certain important points here about using a mask. So first and foremost, always make sure that you have washed your hands well before wearing a mask, and always wear the mask using the strings, okay, and make sure that you have adjusted the mask well before heading out, so as to avoid keeping on adjusting the mask and touching the mask again and again. Avoid touching the cloth portion, the central portion of the mask. Do not do this. This is wrong. Always adjust the mask from its strings. Remove the mask from its strings and wear it from its strings. Do not touch it here. If you have a mask of a higher quality, like something like an N95 mask, you will have nose adjusting metal bands or strips that can be used to prevent air from escaping on the upper side, and make sure you adjust that when you wear the mask. Okay, make sure that the mask is tight enough but comfortable. It should not make it very tough for you to breathe, but believe me, it is not easy breathing while wearing a mask. In fact, we as doctors and as medical students have worn these masks for a very long time and probably have got slightly adjusted to it now over the years. So I can imagine it is very tough for the general population to wear the mask and be comfortable with it right from the first day. Make sure you don't wear the same mask for very long. Replace the mask if the mask has become damp. Do not reuse the same mask daily. If you have the washable cloth masks, then put it for a wash, let it dry and then wear it. If you don't have the washable ones and if you want to reuse any of your N95 masks, do follow the directions, such as storing the mask in a clean dry paper bag for 5 days before you can reuse it. So it's ideal that you have about 5 or 6 sets of the non-washable masks if you're using any of those. I see a lot of people wearing almost the mask so many times that the mask has become blackish, brownish, filthy, which was actually white in color to start off with. Yes, masks are not easily available, but please understand that if you do not follow the mask hygiene measures, it is worse to wear a dirty mask than not wear a mask at all. So also make sure that you're not wearing a mask continuously for more than 6 to 8 hours. I have had patients who have ended up with a lot of skin infections in this area because they have been continuously wearing a damp and a dirty mask. Another important point is that you must not forget to wash your hands after removing your mask. Yes, washing your hands after removing your mask is also equally important. Wearing a mask is only additive to the other measures of prevention that need to be taken for preventing COVID infection, which include hand hygiene, staying at home unless it is really important to head out, necessarily stay at home if you're feeling sick, and maintaining physical distancing. I'm against social distancing because it is important for all of us to socially remain in touch. So I'd rather replace it with the word physical distancing. Yes, maintain at least 1 to 2 meters distance from people whenever possible, and or rather at all times, I must say. And the other important thing is there have been a lot of reports coming where people are trying to wear a mask and start running or jogging. Now this could be injurious to your lungs, so be very, very careful, and it's better you exercise or jog in open areas which is free of crowds or other people, or stick to your terrace or room and try and do exercises that involve using your own body weight, or other cardio exercises that don't involve you going outside. So with this, please use your mask properly and stay safe.